Here at COMI, I have the pleasure to talk about technical tips for a reliable MRD assessment. First, I will address in whom, in which patients, and mainly it's all about making the best of a bone marrow aspirate that is only recommended for patients achieving a negative immunofixation, without forgetting that approximately 20% of patients in VGPR may also have a negative MRD and a favorable PFS. Therefore, we are also recommending to consider performing MRD in patients with a prolonged VGPR. And then when, with the relevant time points according to the different treatment scenarios. Then how fortunately in myeloma is very clear. It's all about following the guidelines that were proposed already in 2016 and that, in my opinion, remain useful and valid for 2023. Then the methods. Well, I think that these days it is unquestionable that next generation flow and sequencing are highly reliable for MRD assessment. Imaging is complementary, particularly when using PET-CT, and the most important criterion is the one of sustained MRD negativity. And then once you select the methods, obviously based on the resources available in the Department of Hematology, also the samples that are available, then it's all about making the best of what the technique can offer. And at the last part of my presentation, I will focus on some of the additional information that you can obtain using flow cytometry, such as the measurement of the quality of the sample to avoid the risk of severe hemodilution, using flow also to characterize the patient immune status and eventually predict those that are at risk of severe infection, something more and more important with the new treatment scenarios, and finally creating new tools to identify unexpected behaviors. For example, patients that despite a positive MRD may enjoy long progression-free survival, and we are seeing that some, not all, some of these patients have an MGUS-like phenotype, a diagnosis, and now we have created an open access web-based calculator so that everyone can define can ask the question if a patient has an MGUS-like phenotype at diagnosis, and these patients have favorable outcomes regardless of the depth of response achieved after frontline therapy.